Hi. I don't think we've met before. I never forget a face. Okay, that's what I thought. Well, I'm Dr. Shani. It's a pleasure to meet you. And is this your first time at our clinic? I didn't see you in our system. It is? Well, welcome. Do you mind me asking how you heard about us? Friend referral. Okay, great. What is your friend's first and last name, if you don't mind me asking? We just like to give them benefits like $20 off their next pair of glasses or contacts for referring you. Okay. Great. I'll put that in their system, and if you want to let them know, they'll just have a discount waiting for them next time they come back. Great. So, I have your first and last name. Do you mind just verifying it for me? Okay. Excellent. Now, typically we'd have you fill out this form for us while you're waiting in the room, but because of everything going on right now, to keep things safe, I'm just going to fill this out for you. Is that okay? Great. It's not too long, as you can see. We're just going to start by getting some information, maybe some symptoms you might be feeling, and your medical history, okay? Great. So, what is your middle initial? Okay. And your address? Okay. And the city and state? And your zip code? Oh, that's easy. Perfect. All right. And the best telephone number that we can reach you? This is just in case you need an appointment reminder. We have to reach you regarding your insurance or an exam update, maybe to let you know that your glasses are ready for pickup. Okay. And I'm guessing that's a cell phone number. Great. All right. Cell phone. And then do you mind giving me your date of birth? Okay. We don't need that next one. I don't need your occupation or employer. Do you prefer to get notifications via your cell phone, or would you prefer I email them to you? Cell phone. Okay, then I won't need your email. All right. And your marital status. Okay. And who is your health insurance carrier? Okay. And your group ID. Okay. And your vision insurance carrier. Okay. When was your last eye exam? About a year ago. Okay. Good. And you went to a different office. Which one was that? Okay. And where is that located? Oh, all right. So you moved. Understandable. Okay. Now, are you currently experiencing any problems, or are you just here for a routine eye exam? Well, that's okay. Problems can be like blurred vision, halos, like where you kind of see like a ring of light. You could have some maybe redness, flashes, itching, dryness, maybe some double vision, headaches, anything like that. Well, that's okay. Totally fine, all right. dryness is common with contacts. Do you have contacts or a prescription for glasses or anything like that? Yeah? Okay. Do you know your prescription? Great. Okay. And do you feel like that's still working for you, or is it getting a little blurry or causing any headaches or strain on your eyes? Okay, not a problem. We'll definitely test it today and see if we need to change it or if there's anything we can do to better help you, okay? Good. Now, have you ever been told that you had any family history or you have any history of these conditions such as cataracts, maybe like lazy or cross eyes, glaucoma, retinal detachment, blindness, melanoma of the eyes? Okay. And you said you wore contact lenses. Let's see. Are you interested in LASIK? Okay. It's not for everyone, but if you were interested, we can give you a pamphlet on more information on that, or we could go over how that works for the future. Okay? Okay. So we are going to be dilating your eyes today so I can take a look in there and see how everything's working. So I just need you to confirm if that's okay with you or not. Basically, it says right here that dilation is recommended every 2 to 3 years, even in healthy eyes, okay? So dilation may be required more frequently by your eye doctor for more ocular and systemic conditions. Many serious and sometimes vision-threatening conditions cannot be accurately diagnosed or detected without dilation. Dilation will make you light sensitive and will make your distance and reading vision blurry. So driving after we do this is usually unsafe, and the patient assumes a risk of operating motor vehicles of any kind, okay? So we would recommend someone come pick you up after. Now, any other visual demanding tasks while dilated will also be kind of strenuous, but we do recommend you letting me do it in today's appointment just to make sure everything looks good. Would that be okay? Would you be able to have someone come pick you up? Oh, good. You already planned for that? Excellent. So I'm going to mark yes, all right? Okay. Now, I just have to get some information on your medical history. Do you have any anxiety or like heart disease, hypertension, high cholesterol, asthma, ulcers, maybe muscular dystrophy, fibromyalgia, rosacea, shingles, any things with your thyroid, any medical conditions you can think of? Okay. You have a history of migraines? That's good to know. Okay. Yes, that also includes your family history. Okay. And lastly, are you currently on any medications? Okay. And you don't have any allergies to anything that I should know about, even medication-wise? Okay. And is there anything else you want to make me aware of before we continue? Okay. So I have everything I need for our system. So, basically I'm just going to be getting some information from you regarding your eyes today, okay? I have this little chart right here, and we'll just be going through line by line and testing to make sure everything is working and up to date, since this is just your yearly exam on your eyes, alright? Okay. So, it does ask here for your prescription, which we already got. So let me write that down. Okay, let's get started then. I'm just going to start by sanitizing my hands and say I'm going to be getting a little close to you. Basically how things work here. I'm going to start by taking a look in your eyes. And I'll have you follow the light and do some other tests to make sure everything is working correctly. And then we'll do the dilation portion at the end. And I'll go ahead and I'll check around your eyes just to make sure your muscles and everything are feeling okay. Does that all sound all right with you? Great. So, due to everything going on, I'm just going to put on some gloves real quick. Better safe than sorry, since I am getting pretty close. Okay. So how are you doing today? Good. I know coming to the doctor can be nerve-wracking, but I'm glad you're having a good day. Yeah, even if it is just for a routine exam, a lot of people tend to get white coat syndrome, but we're here to help, so no need to stress. Everything's going to be okay. So, let's start by taking a look in those pretty peepers, shall we? I want you to look directly at my nose and try not to move your head, your neck, or your shoulders, okay? And yes, try not to blink if that's okay. Alright, here we go. Okay. That eye looks good. Check the other one here. Good, everything looks good. Alright, now I'm just going to hold my hand up right here and I'm going to swing the light from eye to eye, alright? Here we go. Okay. Perfect. Your eyes seem to be responding to the light correctly, so nothing to worry about. Let's just have you follow the light with your eyes, okay? So, again, stare directly at my nose and try not to move your head, neck, or shoulders. Okay? Great. Here we go. Good. You're doing great. Try to keep your head more still. Just follow it with your eyes. Excellent job. Okay. Next, what I want you to do is continue to stare directly at my nose here. I'm going to hold my hands off to the side, and I just want you to tell me on what hand you see the finger, okay? Alright, here we go. Good. Excellent. Good. 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 Tried to trick you. Mm-hmm. Good. Okay. We're going to do a similar test now. I'm going to hold my hands up to the side, but this time I'm going to hold up a number, and I just want you to tell me on what hand you see it and how many fingers I'm holding up, okay? All right. If at any point you have any questions throughout this exam, please feel free to stop me and ask, okay? Great. Here we go. 2, 2, 4, 3, 4, 5, 1. Good. Mm-hmm. Good. Good. Mm-hmm. Good. Good. Good job. All right. I'm just going to write that down. Okay. All right, next here, I'm going to hold up this pen, and I just want you to follow the tip of the pen with your eyes, okay? All right. Exactly. You're just going to keep everything still again and follow it with your eyes. Here we go. Good. Good. Just keep following it. You're doing a great job. Good. Good job. Now, so far on any of those exams, have you noticed any discomfort or no? All right. Great, great, great. Okay. We're going to do one more test like the fingers. This time I'm going to be wiggling my fingers, and I just want you to tell me when they go out of your field of vision, okay? All right. Here we go. Good. Good. Great. Good. 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 Good job. Okay. Everything is looking good to me so far. Let me just go grab a couple eye charts and we'll continue, okay? All right, I'll be right back. Okay, so I went out and got my eye charts. Do they look familiar? Yeah, they're your standard eye chart. Typically, you would see these hung up about 10 feet away. But because this is your yearly checkup, I like to hold them and move them at different lengths so I can test your eyes on how nearsighted or farsighted you are, okay? Okay. So, do you have any questions for me? No? Alright, well, feel free to ask me if you think of anything. So, what I'm going to do is hand you this little spatula. It looks familiar, I'm sure. going to hand this to you, and I want you to start by covering your right eye, and then I'll have you move it to your left, okay? All right, here you go. And I'm just going to have you read the letters that I point to, okay? All right. Go ahead and cover that right eye. F O P E. Good, good. C P F. And can you make out this one right here? C. Good. Yeah, I know those bottom rows can get a little tricky. Let me move back a little further. Okay, are you ready? All right. F O P L. Good, good. E. Can you see this one? E. Yep, another E. L. Can you make it out? F. Good. And O. Great job. Go ahead and cover the next eye. Are you ready? Okay. P. Z. Good. P. L. C. F. Z. P. Yeah, what about this one? P. Great job. I'll move a little closer. P. Can you tell? C. E. F. P. D. P. C. L. This little tiny one, F. Great job. Okay, this time you can just hold the spatula at your side, and I want you to read the rows as I point to them, okay? Okay. Okay. Good. Great. Good. Good. How about this one? Good. And the next one? Alright, so this is about when it gets a little too hard. It's not bad. Not bad at all. Alright. Let's move on to our next eye chart. So, go ahead and cover that right eye for me again. Good. Here's the next one. It just has a bunch of E's facing different directions. And basically, I'm just going to have you tell me what direction the E is facing, okay? Okay, good. So, let's get started. Good. Good. Down. Right. Up. Up. Left. Down. Up. down, up. Great job. I'm going to step a little further back. Are you ready? Okay. Good. 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 Excellent job. Go ahead and switch to the next eye. Okay. And you're ready? Here we go. Down, up, right, up, right, up, down, left, down, up. Great job. All right. We're just going to do this one a little closer. Left, right, good, good, good. Excellent. Good. Great job. Doesn't seem like you're having any problems. And you're not finding any of that strenuous or hard on your eyes. I'm glad to hear it. Okay, so I'm just going to write that down real quick. All right. Okay. So, next in this exam, I'd like to test your color blindness and to make sure that you have your full range of color. So I have this chart right here. Okay, looks familiar, I'm sure. And I just want you to tell me what number's in each circle, okay? Yep, that easy. You actually don't need the spatula anymore, so I can take it from you. Thank you. Alright. So, what's in this first little bubble right here? Can you see it? Yeah, it's a 7. Excellent job. And that's testing to make sure that you don't have any problems with greens and blues. Next, what's in this bubble right here? Yep, great job. We have a 13. And that one was testing reds and oranges. How about this last one over here? 16, good. Yep, that one was testing more orange. And this one down here. 8, good, good. What about this one? This one a little hard. Can you see it? 12. Yep, 1, 2. What about this last one right here? 9. Great job. Okay. So it doesn't look like you have any problems with seeing colors, which is good. Now, I just want to do a more thorough look into your eyes. This is going to be the dilation portion. So do you have any questions about how this is going to work? No, it doesn't hurt, I promise. They're just little eye drops. We're going to put them in there. Your pupils will dilate and I'll get a good look inside, okay? Okay. And we'll give you some funny looking sunglasses you can wear afterwards, just until your sight comes back, okay? Good. So here are our little eye drops. Just give these a little shake. Alright, here we go. And go ahead and just blink a little bit and let those kick in. It should happen pretty quickly, but we'll give them a moment. While that's going on, I'm just going to feel around your facial muscles. Is that okay? Because I do have to get a little close. Good. Alright, here we go. Just want to make sure that everything feels good. Okay. And let's just check those eyelids. Okay. And your eyelashes. Okay. Those look good. We have a good amount too. Nothing's falling out. Alright. And you don't have any like pain or anything around your eyes or muscles of the face, do you? No? Okay. Well, good. Good. Alright. That all looked good to me. Just putting that down on your chart real fast. Okay. Now, you are going to be sensitive to light, so this may irritate you a little bit, but I just need to shine a dull light in there just to make sure I can see to the back and see how your corneas, your pupils, everything like that is working, okay? Okay, here we go. Alright, your scleras and everything right there. Looks good. It's not bothering you too much, is it? Okay, good. Everything was reflecting back correctly. Let's just check the other eye here. Okay. Good. Getting good reflection, and I don't see any cloudiness or anything that could cause any vision problems. Okay. Your lenses and everything looked good. So, lastly, I'm just going to want to test and make sure that your prescription's right for you. So I'm just going to put some lenses down in front of your eyes, and I just want you to tell me if it makes what you're seeing behind me better or worse, okay? Okay. I'm going to stand over to the side here. And here's the first one. Okay. Did that help or did it make your vision worse? Okay. Good. And the next one. Better or worse? Okay. And next one. Okay. And one more. Okay. Let me just take those off. Alright. Well, I don't think we need to change your prescription. It seems like it's still working for you. And your eyes look healthy, so I don't see any issues here. Unless you're having any pain or experiencing any problems, I think you're all set to just make your next appointment for another year out, and we'll see you then, okay? Alright. Well, it was a pleasure meeting you. And I hope you have a great rest of your day. Just remember to wait out there till your ride gets here, okay? Alright. Bye.